Hello, and welcome to the next episode of Market Intelligence CrowdStrike Coffee Chat Series. My name is Marianne Antonelli, and I am the CrowdStrike Marketing Campaign Manager at TD SYNNEX Public Sector. If you've been with us before, we are on episode number 6, and today's topic is public health in SLED. If this is your first time attending the Coffee Chat and would like to access the previous episodes, please be sure to message us in the chat box and we'll get you hooked up. And as a reminder, this is an exclusive webinar for CrowdStrike's authorized resellers. And this webinar is brought to you by TD SYNNEX Public Sector, an authorized CrowdStrike distributor and the premier government solutions aggregator. Next slide, please. But before we get started, let's go over a few housekeeping items. Your lines will be muted for the duration of the webinar. However, if you have any questions throughout the presentation, feel free to drop any questions in the Q&A or the chat field. This session will be recorded, and right before we conclude today's episode, please be on the lookout for a link to a very short survey. Tell us how we did so we can make any kind of adjustments for future Coffee Chat episodes. And as always, if you have any technical questions, please message Felicia directly in the chat. And now, a brief introduction for today's featured barista. Today we have Yvonne Mafia. Yvonne is a senior analyst in the Market Intelligence Organization, covering state, local, and education markets. She applies insights and analysis to purchasing trends to help vendors and partners shorten their sales cycle. Prior to joining TD SYNNEX Public Sector, Yvonne spent 8 years working in state and local government, where she oversaw advisory boards across the state of Florida and served as an analyst to a local politician. Yvonne currently lives in Washington, D.C., and in her free time, you can find her hiking, bird watching, and doing some yoga. And now, without further ado, over to you, Yvonne.
Thanks, Marianne. Good morning, everyone. Welcome back to the Coffee Chat series. I'm really excited to have you all here with me today to discuss SLED public health opportunities. Again, my name is Yvonne Mafia, Senior Market Insights Analyst with TD SYNNEX Public Sector. Okay, next slide, please. All right, so fortunately for the SLED market, we've seen post-pandemic government stimulus funds, such as those that were allocated from the American Rescue Plan Act of 2021, which was designed to boost economic recovery and provide pandemic assistance, coupled with the implementation of the infrastructure law and the Inflation Reduction Act. It provided states with a safety net and some insulation from recessionary effects. So states were able to recoup revenue losses and kickstart new projects that might have stalled due to funding issues. So taking a look at the forecast today and heading into the rest of FY24, the SLED market is stable and the public health vertical will continue to see steady IT budgets. The health and human services and education verticals, they're typically the largest areas of spend for SLED governments in general. And in FY24, public health represents approximately 17% of total SLED IT spend. So that's quite a bit. State and local public health organizations receive most of their funding from federal funds. That could be considered things like block grants, right, that are paid to the state and then distributed to localities. County appropriations are another source of revenue for local health departments, along with fees that local health departments receive from sources such as clinical sources. Now, public health organizations also receive money through grants. For example, the CDC awarded $3.84 billion through the Strengthening U.S. Public Health Infrastructure, Workforce, and Data Systems grant, which was designed to help U.S. health departments promote and protect health within their communities. Now, the majority of states have received money from grants, including the FCC's COVID-19 telehealth program, the distance learning and telemedicine grant program. We saw the tribal broadband connectivity grant program, and then various other programs housed under IJA. Now, even though the majority of this funding has already been allocated, there's still going to be a cybersecurity play here, as there's continued implementation of modern public health IT infrastructure. Now, the IT addressable market for 2024 is around $137 billion. So there's ample opportunities for new technology acquisitions. Okay, next slide. So I wanted to start here by going over a few statistics about public health cybersecurity. So this might not come as a surprise to anyone here, but more than 39 million individuals have been impacted by healthcare data breaches reported in the first half of 2023 alone. And we've seen a total of 34.9% of cyber attacks occurred in healthcare in 2022. That's up 1% from the year before. The average cost of a healthcare breach right now is about $10.1 million, and that's more than double the average for all industries, and also up 40% in the last 2 years, which is pretty alarming. Healthcare is now the most targeted industry for cyber attacks. A lot of this has to do with the fact that the black market value of medical data is remarkably high. Clearly, we've seen healthcare security challenges continue to be a big cause of concern. And now we're seeing cyber criminals become more and more strategic and aggressive, and they're really looking at the healthcare industry as an easy target. Hospitals face budgetary pressures and really need additional resources to protect their systems, but they face challenges like any other SLED entity around endpoint systems, regulatory pressures, and internal roadblocks due to things like governance and politics. Increasing risks are also corresponding to the increasing digitization of health. And since cyber attacks revolve largely around patient records and medical information today, but the threats are rising to medical devices, telehealth, pharmaceutical R&D, and public health as they undergo computerization and become more data-centric and connected. Hospitals typically utilize a multitude of endpoints. This varies from medical computers to BYOD mobile devices. And these endpoints are especially risky as cyber criminals look to disrupt infrastructure and steal valuable electronic personal health information. So CrowdStrike can be a great partner to the healthcare industry as they continue to navigate things like endpoint management. Okay, next slide. Okay, so each of the categories I've listed here is representative of a translatable opportunity for CrowdStrike initiatives. Now, this is trickling from the national agenda, top priorities and pain points, and they all play a role in the developing need for technologies that support enhanced public health cybersecurity. So I'm going to start on the left-hand side here with the top-down initiatives. So some of the top influencers that have implications for CrowdStrike are the issuance of the National Cybersecurity Strategy and related federal directives, such as the bipartisan fiscal 2023 Omnibus Spending Agreement. That included a big boost for CISA and NIST. And we've also seen federal efforts to combat ransomware really influence state leaders' security agendas. That's reflective in executive orders and Congress's establishment of the Joint Ransomware Task Force, which is an interagency body that's aimed at decreasing the frequency and severity of ransomware attacks. Now, on April 17th of this past year, the U.S. Department of Health and Human Services, their 405D program, announced the release of specific resources that are aimed to help address cybersecurity concerns within the healthcare and public health sector. So some of these resources include a new platform they designed called Knowledge on Demand, which is designed to provide free cybersecurity training to the health sector workforce, as well as an updated health industry cybersecurity practices 2023 edition that's designed to be kind of a cybersecurity guide, and a hospital cyber resilience initiative landscape analysis. Now, this program was initially developed in response to the Cybersecurity Act of 2015. Efforts were geared towards enhancing cybersecurity, aligning industry approaches by developing a common set of voluntary, consensus-based, and industry-led cybersecurity guidelines, practices, methodologies, procedures, right? All these things that healthcare organizations can utilize. The Health Sector Cybersecurity Coordination Center, otherwise known as the HC3, that's part of the Department of Health and Human Services cybersecurity program. Its mission is to support the defense of the healthcare and public health sector's IT infrastructure. This group was designed to advance agency efforts to coordinate and share information within the sector by really encouraging cybersecurity resilience, regardless of organization's technical capacity. Now, this center creates education and mitigation resources while also fostering collaborations and partnerships. The Health Industry Cybersecurity Practices, Managing Threats and Protecting Patients, or HICP, that was the primary publication under the Cybersecurity Act of 2015, the 405 Task Group. And its goal was to raise awareness, provide vetted cybersecurity practices, and move organizations towards consistency when mitigating the most relevant cybersecurity threats to the sector. So the HICP examines cybersecurity threats and vulnerabilities that affect the healthcare industry. Further, with the passage of the Consolidated Appropriations Act of 2023, the FDA is now required by law to include cybersecurity in its review of certain medical devices that contain software and connect to the internet. The Cyber Incident Reporting for Critical Infrastructure Act of 2022 mandates reporting of cyber incidents within critical infrastructure, and it really addresses the need for rapid response and coordination when this industry is in the face of cyber incidents that target their vital infrastructure. Now, the legislation emphasizes reporting for key sectors with real emphasis on healthcare and public health. We're still awaiting the final rule. So when the final rule and implemented requirements are expected to go into effect in late 2023 to early 2024. So we're going to be waiting for that. Okay, next slide. All right, so now we're going to the drivers here. So from a holistic standpoint, the post-pandemic era of modernization really exposed the fragility of public sector technology infrastructure and systems, widening attack surfaces, and posing additional challenges for all SLED leaders. We've seen continually evolving security threats ranging from threats to critical health infrastructure, ransomware attacks, hacktivism. They're all creating this heightened threat landscape, and SLED leaders have identified cybersecurity and risk management as their top priority once again. So as public health institutions continue digitization and modernization efforts to really enhance operations, critical infrastructure, and service delivery, they're facing challenges around things like regulatory compliance requirements, risks of having outdated legacy systems, malware attacks such as ransomware, phishing and social engineering attacks, and overall cybersecurity talent gap shortages. As the healthcare vertical continues to adopt and utilize a wide range of emerging technologies, which include, artificial intelligence, machine learning, IoT, blockchain, cloud computing, big data and analytics, right? All of these things. They're using these to enhance service delivery and become more efficient and effective. And the addition of these new technologies, as great as they are, it's creating additional vulnerabilities that need to be addressed. For instance, remote and hybrid work and telehealth environments, plus an increase in the coupling of critical infrastructure and digitization, has expanded the cyber attack surface for healthcare institutions. Cyber criminals and advanced persistent threat actors are taking advantage of these existing gaps and vulnerabilities that are associated with poorly secured systems, and they're attacking critical services and stealing this highly sensitive patient information and medical data. And healthcare exists in a realm of complicated and complex rules that make it all the more important to enhance cybersecurity efforts and protect patient data so that they can meet these compliance standards. And I'm actually going to touch more upon the various relevant regulatory frameworks a little bit later on in the presentation. Okay, so next slide, that brings us to the pain points. As I just mentioned, public health modernization efforts plus the use of emerging technologies is widening attack surfaces. This is leading to more threats and attacks, such as ransomware attacks, which now account for about 50% of all healthcare data breaches. Public health leaders are addressing pain points around these efforts, which includes the wide range of connected medical devices, the usage of personal endpoints, such as those from BYOD devices, and the infrastructure that corresponds with this telehealth and telework environment. The lack of MFA implementation is another problematic pain point across the public sector, and it poses risk to healthcare organizations that are dealing with this sensitive patient information and data. Cyber criminals are becoming more aggressive in their approach and take advantage of the healthcare industry as an easy target. So again, we're seeing hospitals face these budgetary pressures and lack of resources. They're not able to protect their systems the way they need to. This multitude of points and endpoints, such as third parties' access to sensitive patient data, increasing risks are also corresponding to this digitization of healthcare services. And again, cyber attacks revolve largely around patient records and medical information today, but the threats are also increasing to medical devices and, again, things like pharmaceutical R&D and public health data as this computerization movement continues. Hospitals typically utilize a multitude of endpoints, and that varies from medical computers, again, to these BYOD mobile devices. So these are especially risky as cyber criminals look to disrupt infrastructure and steal valuable electronic personal health information. Cyber threats and attacks pose additional challenges to healthcare organizations, such as the disruption in healthcare work, and then they're not able to access patient data, which could also negatively impact patient care and medical procedures. Okay, so next slide, let's go to the solutions. So this brings us to possible solutions. Public health organizations need to be able to reduce attack surfaces and ensure regulatory compliance while managing emerging risks. So this is a great opportunity for CrowdStrike's threat intelligence tools to come into play, as healthcare organizations need to have the visibility and capabilities to detect patterns and become more resilient. If they can identify emerging threats and have that pattern visibility and continuous monitoring, they then lessen the potential of a serious breach or attack. State CISOs, we're seeing they're hoping to utilize cybersecurity related funding initiatives, such as IJA's $1 billion cybersecurity grant program. They're hoping that'll kind of jumpstart their own statewide cyber strategies and have a little bit more push towards cybersecurity policy and solution implementation. Public health organizations are also following behind federal security standards. A lot of them are moving towards the adoption of zero trust models with IAM as a top pillar. Now, organizations can significantly reduce the risk of unauthorized access to patient data by implementing MFA. Managing access for remote workers, integration across services, and sophistication of platforms to manage these modern connected anywhere models are all factors affecting public health. Zero trust can really help secure public health ecosystems that are utilized by a wide range of users who all need access to various applications and data. Zero trust can really help manage the scope of access to healthcare data within all of these applications. And as modernization efforts continue, public health organizations face increasing challenges around security and associated industry regulatory pressures. So CrowdStrike can help public health organizations maintain this regulatory compliance by maybe providing advanced threat detection and response capabilities that can safeguard this critical patient data and assist with conducting yearly risk assessments, for example. So as we continue into SLED FY24 and this continued era of IT modernization and digitization, we can really expect that we're going to see continued increased demand for cybersecurity related vendor solutions within the public health vertical. Okay, next slide. So now I want to turn our attention back onto these critical cybersecurity health regulations that you should be aware of, and how CrowdStrike and their partners can assist healthcare organizations in meeting these compliance standards. Okay, so the first one, we have HIPAA's security rule. So this is an important regulation for healthcare cybersecurity. It applies to all covered entities or business associates of a covered entity. At a bare minimum, the security rule requires a risk assessment be conducted at least once per year. It also requires specific safeguards to be followed for all electronic personal health information. So CrowdStrike can assist public health organizations with HIPAA compliance by maybe providing the advanced threat detection and response capabilities, again, that can protect this critical patient health information. And then that'll help assist with yearly risk assessments, which helps in turn meet compliance. And as I mentioned earlier on, the 405D regulations, that's a joint effort between the healthcare industry and the US Department of Health and Human Services. So under that Cybersecurity Act of 2015, HHS created the 405D task group. Now, the purpose of this task group is to create a common set of voluntary, consensus-based and industry-led guidelines, practices, methodologies, procedures, and processes that healthcare organizations can use to enhance their cybersecurity. So the result of this effort is a framework called Healthcare Industry Cybersecurity Practices, or HICP, which helps organizations implement healthcare cybersecurity best practices for things like medical device security, incident response, network management, data loss prevention, all of these things. CrowdStrike can help healthcare organizations implement HICP guidelines, strengthening their cybersecurity posture, particularly in areas like medical device security, incident response, and data loss prevention. Now, all HIPAA covered entities are required to adhere to the guidelines from the 2009 Health Information Technology for Economic and Clinical Health Act, or HITECH. This encourages the adoption of healthcare technology, such as electronic health records. It also added new regulations to address patient privacy and security concerns that are associated with sharing protected health information electronically. HITECH also addresses patient privacy concerns and made civil and criminal HIPAA penalties a bit more severe. It added the requirement for annual healthcare cybersecurity audits. It created a tiered HIPAA violation system. It extended HIPAA's privacy rule and security rule to business associates, and it strengthened the breach notification rule. So CrowdStrike helps organizations conduct annual healthcare cybersecurity audits, right? Adhere to these tiered HIPAA violation systems, and be able to extend compliance to business associates while bolstering breach notification capabilities. Now, the payment card industry data security standards, that applies to any healthcare organization that processes credit cards. So PCI DSS specifically covers credit card information and ensures that providers protect the privacy of people who pay for medical services with a credit card. This rule governs how all credit card data is processed, stored, and transferred. So in this capacity, CrowdStrike can help healthcare providers maintain secure processing, storage, and transfer of credit card data in accordance with these regulations. Now, in response to cyber criminals' attacks on medical devices, the FDA actually instituted what we're calling the Quality System Regulation, or QSR rule. This primarily applies to organizations that manufacture medical devices, but it also applies to any practice that uses medical devices. The legislation requires a company to design medical devices to prevent unauthorized access, conduct risk management, monitor IoT medical devices and their use, update firmware, and then regularly conduct maintenance. So here, CrowdStrike can assist in monitoring IoT medical devices, helping to update that firmware, and then helping with the maintenance to ensure compliance with QSR. Now, HITRUST is a cybersecurity framework that seeks to unify the rules for many of these other existing regulatory and industry frameworks, since there's a lot of them and it's very complex. It's a global framework for healthcare cybersecurity, and it maps really well to many HIPAA guidelines. So it's a useful resource for healthcare organizations that want to help kind of enhance or boost internal compliance, and also third-party vendor cyber compliance. Now, this complex web of healthcare industry regulations makes it all the more important to have the proper security measures in place. So I think this is a really great opportunity for CrowdStrike to help healthcare organizations navigate these framework requirements and ensure robust cybersecurity practices and compliance. Okay, so next slide. All right, so here I've highlighted states with the largest budgets. Naturally, the larger the IT budget, we think that there's going to be more wiggle room, right, to have new technology acquisitions. These top states and counties represent our top customers that are buying new cybersecurity tools and solutions. So this lays the groundwork for that buying landscape. California, for instance, has a $451 billion state budget. Its IT budget is close to $13 billion. So California alone is a huge opportunity market. And then Florida, for instance, made a $100 million multi-year pledge towards cybersecurity efforts. And then to get region specific, within Florida, Miami-Dade County has a budget that's close to $9 billion. So that's a huge county budget. All of these states and localities that are listed here represent a viable public health market for CrowdStrike. Okay, next slide, please. So to add some granularity to cybersecurity spend nationwide, I've added here a heat map highlighting state cybersecurity spend for 2022 with top spend spanning from darkest shaded states to the lightest. This quantifies spending based on transactions and cybersecurity keywords. So we made a little bit of a guesstimate here, sort of speak, based on these cyber keywords, and then fleshed out the data to show a representation of top spenders. So as we can see from this heat map, we're seeing states like California, New York, and Texas, for instance, which corresponds to the largest budgets. They're spending the most money on cybersecurity based on this transactional procurement data. Okay, next slide. Now here I've highlighted the top health spenders by state department. Again, as you can see, this list closely mirrors the top state budgets and top cybersecurity spenders by state charts that I just showed you, but it gives you a little more granularity into the specific state health budgets and their names, and then the corresponding pockets of opportunity. So we can see here we have Texas Health and Human Services Commission, Michigan Department of Health and Human Services, Florida Agency for Healthcare Administration. So a lot of the big name states here. Okay, next slide, please. So another way to identify opportunity for CrowdStrike and partners is to look at the top 10 states with the highest number of data breaches. California is number 1 on the list with a total of 1,338, including 3 of the worst attacks that occurred in 2022. Florida is 4th on this list with more specific data security challenges around healthcare. And when we think about states that will need the most assistance in bolstering their public health cybersecurity posture with tools like threat detection and intelligence that CrowdStrike provides, these states are facing the greatest challenges in terms of data security, and they're going to be the prime opportunity targets. Okay, next slide, please. Yet another way to highlight opportunity is to look at the top 10 most regulated states. These aren't all healthcare regulations, but California is the state with the most heavily regulated or most regulations. So it's considered the most heavily regulated state in the nation. It totals 395,608 regulatory restrictions. So quite a few challenges here. States typically have 135,000 regulatory restrictions and administrative rules for comparison. Administrative and support services, that includes things like employment services, collection agencies, telephone call centers, that totaled around 387,007 restrictions nationwide. Texas has the highest number of regulations in this sector. And California, Colorado, Connecticut, Utah, and Virginia have also enacted comprehensive consumer data privacy laws. That's just to say that that's going to boost the overall need for cybersecurity, as data privacy and security are working in tandem with one another. So again, these are all leading indicators of public health cybersecurity need, as they really go hand in hand with compliance requirements. So these 10 states will most likely have the most compliance requirements, generating a need for additional cybersecurity solutions. Okay, so this next slide. This concludes the end of my presentation. So I'm going to turn it over to you now, Caleb. Thank you all for joining me today.
Thank you. I appreciate that. First off, I just wanted to say thank to you personally for jumping on here and going over this information with us. It's great knowledge for us to have moving forward with prospecting, working with our customers as well. Also wanted to thank Marian and Felicia for also helping getting everything set up, and then also thank everybody that's attending the webinar today. As we know, this takes some time to hear all day. With that being said, we will be sending everybody that attends a little gift card just for your thank you to Starbucks, for you guys to take some time and get some coffee whenever you have a second for attending. And then also, if you have additional questions as you see on the screen, feel free to reach out to any of us on the team here, as we'll help you. More than happy to field those questions for you guys. If you have an additional needs or anything like that, as well as be mindful that we have a end of year roundup coming up on October 12th from 11 to 11:30, which will be episode 7 of this series. And you can register via the link that you see on the screen as well at dlt.com/CrowdStrike, or reach out to us for the registration link as well. Marianne is now going to go over a few questions, and there will be a post survey that we would ask you guys to fill out with your honest information. So Marianne, I'll hand it over to you.
All right, everybody. So I see some questions coming in, but if you do have any questions, please drop it in the Q&A. First question that I see here is, do you have any recommendations for identifying and profiling specific targets in public health?
Yeah, absolutely. Thank you, Marianne. So first and foremost, right, understanding your customer's public health mission and strategic goals. That's kind of the foundation here. Really try and gain a comprehensive understanding of what their long-term vision is and what their priorities are. Focus on establishing and building that relationship that's sustainable for all parties involved. Discuss how your product or service can add value to help accomplish these goals. And then identify the types of relationships that the organization has with the constituents or the public. Identify who has budgetary input. Pinpoint the specific needs of each decision maker that's going to be involved in the process. Know who all the key players are, right? And who controls the budget. And it's important to keep in mind that the scope of the project will influence the decision makers and staff that you'll want to target during the procurement process. For example, a public health hospital looking to implement an electronic health records system migration would most likely affect every department within the hospital. So that influences efforts for stakeholder engagement and includes more representatives than maybe you initially anticipated.
Great. Okay. Question that came next is, who are some of the key roles and responsibilities I should target when selling into public health?
Yeah, so within public health, there are a lot of roles and responsibilities that differ depending on the solution, right? So I'd say during the planning stage, developing relationships with finance officers, CFOs, CEOs, and board members can be valuable to gauge the budgetary impacts of a project. Public health department heads, on the other hand, chief medical officers, pharmacy heads, and other medical leads can help with end user stakeholder identification. Billing and regulatory staff can be helpful resources when implementing projects that affect billing, insurance, auditing, legal, and records management systems. Identifying and establishing relationships with end users early on, such as clinicians, nurses, technicians, those that are actually going to be utilizing these products and solutions on a day-to-day, can also help garner support for a new project. Similarly, so patient focus groups or patient representatives can help pinpoint specific issues with a technology that need addressing.
Okay, and so I see another one here. It says, taking a look at emerging technologies, what are some of the most prominent and what is their role across public health?
That's a good question. So there are a lot of emerging technologies that are going to influence public health. With modernization efforts underway in public health and across the whole SLED market, with a goal in public health of personalized healthcare and seamless service delivery, there are many emerging technologies that are and will contribute and will continue to contribute to these efforts. So for instance, IoT assisted wearable sensor devices, the usage of artificial intelligence, blockchain, digital tools, digital inclusion, and automation to help maybe streamline healthcare services and support health education, software that supports remote patient monitoring and telehealth and telemedicine services. The state of Ohio, for example, is using artificial intelligence solutions within its healthcare system to improve stroke detection and notification. And they're doing this while utilizing a cloud-based mobile interface to enhance collaboration efforts when it comes time to analyze the scans and then decide on the treatment course. And we've seen chatbots like ChatGPT and others that are all the rage. So AI-powered chatbots are already being used within public health to automate tasks. For instance, the state of Missouri actually implemented the use of chatbots to assist with public health tasks. During the pandemic, they created the Missouri Department of Health and Senior Services COVID-19 virtual assistant, and that was to help manage health services. But with this adoption of all of these emerging technologies will come the need for reducing cybersecurity risk and to make sure patient health information and other sensitive medical data isn't compromised.
All right, thank you, everyone. I don't see any more questions. Sorry we went a little bit longer, but this is great information and thank you for hanging with us. And we will see you soon for the next webinar. Thank you.
Thank you.
Bye, everybody.